If you're trying to conceive and feeling overwhelmed with fertility advice, then this podcast is for you. Welcome to Don't Tell Me to Relax, your fertility podcast and antidote to unhelpful fertility information. I'm Hannah, a fertility acupuncturist, teacher and campaigner for better fertility education. This podcast aims to empower and inform you about your menstrual cycle and fertility. It's basically all that information you didn't get in sex ed at school, with the aim of improving your understanding of your reproductive health and optimizing your fertility. Good morning, everybody, and welcome to this week's episode of Don't Tell Me to Relax. I am very excited today because I am joined by Dr. Thum, who is a doctor at the Lister Hospital and somebody that I have been to many a lecture with and watched and listened and learned so much from. And lots of patients that I work with also work with him. And he has very kindly given up his time to come and speak to us today all about reproductive immunology, which is a huge topic. And I'm hoping that we are going to break it down and explain it to you so that it's helpful and simple and easy to understand. But before we do all of that, Dr. Thum, hello, welcome.
Hello. My name is Dr. Thum. I'm one of the fertility doctor at the Lister Fertility Clinic. I'm specialized on recurrent implantations. Yes, today I'm going to talk a bit about the reproductive immunology issue, which is a big topic, can be quite scary. So I will try to take it down bit by bit, that, making sure that using a simple term everyone can understand.
That would be great. So shall we start right at the very beginning? Can you explain to us what is reproductive immunology?
Yeah, sure. The immune system is a system that protect us from bacteria, from virus, which is a good thing for us, okay? And without the immune system, we will get sick and, get infection all the time. However, if the immune system is too active, and a lot of studies suggest that it can have negative impact on reproductions because the embryo is not entirely belong to the mom or to the lady, and because it's carry the genetic material of the partner or husband. So if the immune system is too overactive, they can treat this embryo or pregnancy as slightly foreign and blocking implantations or blocking the placenta to expand. Then in that case, it will have negative impact on fertility. So the reproductive immunology is the part of the medicine we're trying to understand between the interaction between the immune system and reproductions. As you can tell, that it's quite difficult to do the research on this topic because in other topic of research, we can get tissue or we can get sample for testing, but for reproduction, we can't really get any sample for testing. So we need to test other issues that related to the conditions.
So what tests can you do to find out this is an issue for somebody?
There's a few tests we can do. And first of all, the first test we do is the Th1, Th2 cytokine, which is a blood test. So we take the blood and making sure that your immune system is not on high alert. Okay. Th1, Th2 cytokine is the molecule released from the immune cell to control your overall immune system. Like if someone have autoimmune disease, the Th1, Th2 cytokine can be quite high. And in that case, the entire immune system can be quite active, including those immune cells inside the uterus. In that case, previous studies suggest that we will have negative impact on fertility or implantations. The second test we do is the blood test to check this cell called natural killer cell or NK cell. Okay. And this is the cell that produced inside the bone marrow. After they make inside the bone marrow, this cell travel everywhere in our body to protect us. Go to the kidney, go to the liver, go to the lung, and go everywhere. And they go to the uterus as well. Okay. So if this killer cell is overactive, again, that can have negative impact on implantations or can cause miscarriage as well. There's a few things we can check about the killer cell. Number one is the number of killer cell, and which is just quite a simple test that just take the blood, put the blood sample through the machine, and the machine will calculate how many killer cells in that sample. It's important information, but it's not very accurate info because someone can have a lot of killer cell, but they're not active, so it will not have any negative impact. Whereas another person will have many killer cell, but they're quite active, then can have negative impact. Okay. A lot of laboratory, they do the killer cell test, they just do the cell count. This is just to count how many killer cell and say that, oh, it's high, it's normal. And I'm afraid that that result is not very accurate. You actually need to see how many of these killer cell is actually active. So the second part of the test is after we get all the killer cell, then we will check how many of these killer cell are active. Okay, so we identify a cell surface marker called CD69. And when the cell is not active, they'll have no CD69 expression on the cell surface. When the killer cell become active, it starts to show this CD69 on the cell surface. Okay, so by checking this CD69 activation marker on the cell surface, then we will know the actual number of killer cells which are active. Okay. Now, again, some of the lab may get it wrong. So they check the CD69 on all the immune cell, which is not right. So you need to select the killer cell and from all the killer cell, NK cell, you need to see how many of them are active. So it's quite a difficult test to do. So there's test number 2. Okay, and the CD69 activation marker, and I have a publications many years ago, is that if this CD69 level is high, it's associated with lower chance to achieve pregnancy or higher risk of miscarriage. Okay. So that's test number 2 of the NK cell. Then there's test number 3, which is really important test. We call it cytotoxicity. Okay. So this is the test that we isolate the killer cell from the blood we took from you. And we actually culture your killer cell with placenta tissue cell. Okay. Of course, this is not your placenta tissue cell. This is the cell that we continue to grow for testing. And then we mix your killer cell and the testing cell together and see the percentage of this placenta tissue cell killed by your killer cell. So this is a very clever test that, we actually check the functionality of your killer cell rather than just, oh, your killer cell you've got a lot of them or it's active, but this one is actually check the aggressiveness, killing power of your killer cell. Okay, so we get your killer cell, put the placenta tissue together, and 24 hours later, we will check the percentage of the placenta tissue killed by your killer cell. Now, as you can see that this is a very delicate test, so it's also very time sensitive. Okay. For example, if I take your blood sample now and not doing the test and leave the sample on room temperature for 24, 48 hours, and the killer cell will have no oxygen, no nutrient. So if we perform a test on this sample, it will not give me a very accurate answer or report. Okay. So that is why, for me, I would say that I need the fresh sample, which we take on the same day, and we do the test on the same day, rather than, send the blood far away somewhere else to do the test, which may not be accurate. Okay. So that is what we call a cytotoxicity test. And from this test number 3, we will perform more testing if we find out that the killing percentage is high. This is important information. Like for example, some clinic will say that, okay, no need to do your test. I just give you steroid, you'll be fine. Or I give you intralipid, you'll be all right. But not always like that. The sub-testing part of this test number 3 is we actually co-culture this medication with the killer cell and the placenta tissue. What I mean is, from the blood I took from you, we isolate the killer cell, put it inside the test tube, we put the placenta tissue in there, and also in the same test tube, we add in medication. Like for example, I put in intralipid, see whether the intralipid able to suppress your killer cell so that it reduce the killing percentage or not. So we test it with intralipid, we test it with penicillin steroid, and we test it with IVIG, and to see which medications actually able to suppress your immune system, rather than just guessing, okay, I give you steroid, it'll be fine. So from this testing, we actually find out that not all the patients, the immune system or the killer cell, able to respond to one particular medications to suppress the killing power. So this is a very important test to identify which medication we can use to help your situations. I hope I make it simple and clear.
Yeah, it was very, very helpful. And so for example, let's say from the test results, we find that steroids, let's say pronisterone, is the most responsive drug. When do people start to take that?
Depends on the situations. If you're trying to get pregnant naturally, I would say as soon as you have a positive test, I will start you on the prednisolone. Okay. If you're planning for IVF with fresh embryo transfer, I will start the prednisolone on day 10 of the treatment cycle. If you're doing the frozen embryo transfer treatment, again, I would say on day 10 of the cycle, I'll start the prednisolone.
Okay.
And for the steroid, you should continue the treatment until you're 12 weeks. And if you take steroid more than 3 weeks, you shouldn't stop the steroid abruptly. And you should weaning it off slowly. Also, when you're taking steroid, you should take medication to protect your stomach as well.
And who should think about taking these tests? Because we work with lots of people who are told, don't take the tests, they're very expensive, the evidence isn't robust enough. But lots of people are very interested in these testing, maybe if they've had lots of failed rounds of IVF, or they've never had a pregnancy, or they've had lots of miscarriage. What would you advise of when people should start to consider these tests?
Good questions. Some clinics actually perform these tests before even starting the IVF treatment, which I do not agree. Okay, because not all the patients need to have this test. From my experience, maybe maximum 8% of all our IVF patients will benefit from this test. So if I do perform this test at the very beginning, 92% of all my patients will, spend a lot of money without a good reason. So only those patients, for example, who have recurrent field implantations or recurrent miscarriage, or we keep on transferring genetically normal embryo back in the uterus, that without any implantation or still having miscarriage, those are the patients will benefit for this test. Again, this is not the test that recommended by the HFVA or the RCOG, because we still need more research to understand, number one, and number two, this test is expensive, and number three, as I said early on, that not all the patients require this test. Okay, some clinic may not agree about this test because maybe, you see, in medicine, as a doctor, it's something that we do not understand. We shouldn't advise our patients. Sorry, my pen dropped. I mean, in medicine, as a doctor, it's something that is not our specialty, or we do not understand clearly. We shouldn't advise our patients. Reproductive immunology is quite a difficult topic, and it's bridged between reproduction and immunology. So, as a doctor, it's something that I do not understand very well. I will not suggest or disagree or advise my patient to. I would say that, okay, maybe find someone that have more knowledge on this topic and talk about it. Yeah.
It's complicated, isn't it? Because it feels like many different areas of fertility medicine, there is often dispute over, or not dispute, but discussion over having certainty. There's lots, because there's lots of different opinions, and there seems to be not 100% certainty in not only reproductive immunology, but lots of different areas of fertility medicine.
I think in medicine in general, there's a lot of discussions, which is healthy, because we need discussions, we need challenge, and from there we need to understand more about the topic. Okay, unfortunately for medicines, it's not black and white because it's biology. Biology is not like binary 100011100. It's not like that. And biology is, you got the trend and you see the history, and even a same person can respond to a medication or a condition or illness differently in different time. So this is biology. And belief is not the right term for medicine. We need to see more evidence. Okay, if I say that I do not believe in that, so this is my personal opinion, but I should look into more, and I should read more research and to see is there any evidence there or not. With reproductive immunology, it's quite difficult to understand. However, if you go to have the library to have a big search in reproductive immunology, for the last 5 years, I can reassure you that it's more than 2,000 publications in reproductive immunology. Okay, if reproductive immunology is something that is not important, why all these people still doing a research in reproductive immunology? Yes, I would say that it's quite important topic, but it's difficult to understand, and also it's very complicated.
Where do you see it going in the future? What do you think the future will be?
The future will be more research, publication, and our knowledge on reproduction will be better. And hopefully, my wish is like we're able to identify one medication that, with less side effects to our body, and we can use that to help the patients. That's my hope. So currently, a lot of research being conducted in other countries like America, Japan, and Spain as well. Not many in UK. I hope in future that something good come out to help our patients.
And why is the test so expensive? Why are the blood tests so expensive compared to other blood tests?
The reason is other blood tests, you take the blood and you put the blood sample in the machine, and the machine will give you a reading.
Right.
And this test, you cannot do that. Okay. So yes, the first part of the test that you put in the machine to count how many killer cells. Okay. Then the machine will isolate the killer cell from the blood sample. Then it's very manual, require a lot of not fiddling, it's not the word, a lot of effort and energy and time to do the test. Okay, so you need to isolate the killer cell and put it inside the test tube. That is why it takes 24 hours manpower to do one sample. And on top of that, you need a lot of consumable and many test tube and cell and culture. And that is why the test is expensive. It's not like other tests, you just put it in the machine and give you a result.
Mm. And if people want to find out more information, because, lots of people come to me saying that they want to find out more information, do maybe read papers, where would you recommend they go to find out more about reproductive immunology?
This is the difficult part for all our patients. Dr. Google is very good, but can be very confusing and scary, and also can lead you to a different path or directions. Okay. I try to put some information in our website, but again, it's difficult because the whole thing is quite personal thing. This need to be personalized. Okay, it's not one test or one treatment fit all conditions. And if I put a statement there, it could be misled at the person, so that, oh, I just need to do this one or just need this test. So yeah, it's quite a difficult situation for the patients. That's why I still would like to see the patient, understand the patient, understand the history, family history, and the conditions. Then I will see what is the test best for this couple or this person. And from there, I will give more information and instruction. Okay. Because the topic is quite huge, if I put it there for someone to read, and a lot of not relevant information is there, actually can make the couple very confused and can be scary as well. So reading is good, understand is good, research is good, Dr. Google is all good, but I would say that maybe after doing all this, come and talk to me, and I will go through your case and answer all your questions and see what is the best for you.
Mm. And can you, I guess you can't, but I'm going to ask the question anyway. I'm sorry. Can you give any guidance into people who might want to consider this test? So is it, because it's not, is it always repeat miscarriage? Is it always transfer failure? Well, like, is there a kind of definitive marker of who should have this test, or is it cannot be as simple as that?
It cannot be as simple as that, but give you a bit of information, right? Yes, for those who have recurrent miscarriage and not able to find out what causing it, that's a good indication to do this test. And also, if someone have recurrent feed implantation with very good quality embryo, again, that's good indications. Or you fail to achieve implantation with genetically normal embryo, yes, again, it's good indication. And also, the person, she has like other autoimmune conditions, because the immune system is not standalone thing. It's very interlinked. Okay. So I'm sure that you see a lot of patients come to see you with Hashimoto, with thyroid problem, with other immune system problem, or family history of autoimmune conditions. All this can be good indication to have this test done.
Yeah.
Sorry, I didn't give you a very specific answer for this one.
No, I know how difficult it is. And I have worked with people in my clinic who have never achieved a pregnancy, either naturally or through IVF. And then they have come and worked with you and they have done all the testing. You have supported them and they have achieved pregnancy. So again, and then there's not many, but they are, like you say, a very small percentage. But people who've tried for many years and nothing has ever happened and no one can find any reason. They've had all the tests done, there's nothing obvious. It's kind of like those really kind of difficult cases where I think, okay, now we sort of need to send them to see you.
Thank you. Also, some of the patients, the local clinic may not agree for her to have this test done. But she feel like she want to have further testing or advice. I'm happy to help these patients. Some of my patients actually not having IVF treatment with me. So I will still support them for them to have the IVF locally, and I will support them with the immunomodulation therapy. You see, sadly, IVF is very stressful. Okay. So one of the things stress is like time, traveling. So if this patient can have the IVF more locally, less stress for her, rather travel all the way to London to see me, and she should stay there and have an IVF there with my support in London. And if anything she need to have, then either I will give her the prescription, or if she need to have treatment at the Lister for just one time, not the entire IVF treatment, I'm happy to support that.
Great. So you can see people from all over the country. Because do you do Zoom consultations for people?
I do Zoom
Okay, great.
consultation.
So
Not only all over the country, I see patients actually all over the world.
Okay, great. So if anybody would like to find out more, get in contact, make an appointment, is something that this is listening to explore further, then the best thing to do is to get in contact with you and then take it from there.
Correct. Patient can contact me at the Lister Fertility Clinic, and then I will can do Zoom consultation, or sometimes is very difficult and complicated case. I will prefer the patient make one journey and come to see me, and also that journey we can do the blood test as well, organized with my secretary. See that sometimes I need to do a lot of drawing and to make the patient understand the whole immune system and her conditions, or also not just the immune system. I will go through everything like, you fail to achieve implantation or continue to have miscarriage. Is it because of the embryo factor or maternal factor? Is it genetic problem or is it any other problem? So I will look into every single item to make sure that we are not missing anything, but just the reproductive immunology system. So in that case, it's a bit difficult for me to do the consultation with Zoom. It's easier that come in the office, they will understand me a bit more. However, I understand that it's not always possible to come to London. Then I can do a Zoom consultation.
And one more question. You can do the treatment for immune regulation. You can do it trying to conceive naturally and with IVF.
Yes. Okay. Interestingly, as a clinicians, we train it in that way that if you have a condition, you need to take medication. You need to take this horrible medicine and blah, blah, blah. Okay. interestingly, recently, a few of my patients, they tested high immune system and have recurrent miscarriage. They work together with like functional medicine practitioner, acupuncturist, dietitian, whatever. And when they come and ask me, I said that, no, you need to take this horrible medicine. And they said, no, I do not believe in you, doctor. I need to improve my general health first. Then I said, okay, you can, you're still young, you got the time. Interestingly, a few patients actually do all this, either traditional Chinese medicine or diet, I don't know what, and come back to see me and with much better immune condition. So yes, that's something that I do not understand, but it worked for some of my patients. I'm sure that you'll be more expert on this than me.
Well, sometimes it's a combination, isn't it? Of combination
Yes.
everything together to get the body as healthy as possible. And that relates to immune, digestion, sleep, all of those things. And then you're in such a better place, whether you
Yes.
need to go
Yeah.
down the route with you or not, you're always going to be in a better place.
Yes.
Great. Thank you so much for your time. I'm going to put all your details on the show notes of this episode so people know where to find you and where to find out more information. And I just want to say thank you so much for your time, because I know you are a really, really busy man. So I really appreciate you giving us your time today. It's really helpful.
No worry. And I wish all your clients have a good outcome.
Thank you. Thank you, everybody. And like I said, all the information is on there. So if you want to find out, please have a look. And I really hope you found this episode helpful. If you've enjoyed listening to this and want to find out more, then come and join my free community in Facebook. We have loads of resources. You can catch up on all our previous webinars and be the first to know about forthcoming events. To sign up, just follow the link in the show notes. And if you'd like to work one-to-one with myself or one of the team, then please see our website, hannahpern.com, where you can book in directly or organise a discovery call to find out how we can support your fertility and your reproductive health.